friends. Again, we are gathered here to hear from our beloved Madam Bhupinder Kaur. Today, she deals with a very special case because majority of us and majority of our relatives, friends, they all are suffering from some spinal issues. Maybe because of the sedentary lifestyle or maybe because of their profession, whatever or however, the problems mainly concentrate on the cervical region or the lumbar region. The result is the pain towards your hands, the wrist, the fingers, towards your knee, towards your foot and all. Today, our madam will give the remedy, the causes and how we can treat and all with live practicals. So please be with us till the end of the session. Before starting the session, I would like to inform you that madam is very much attracted to this group and all the members of this group. Okay, so she is agreed to give 11 days smile meditation special class on free of cost basis for Joshi's Kerala group members. Also, she is very happily introduced us and agreed us she is ready to give how we can balance our energy to keep our life healthy and smile. So you can join all these free sessions, but only on one condition, and that is that condition is from Joshi's sir's side as well as our madam's side, as the people must be very serious of getting this knowledge on free of cost basis. So you should be here for the classes for all the sessions. Then only you can get the session and you can get all the recordings and all. So make sure that you will be available for the date and time when madam is announced. So get ready right from now itself. We all know that our madam is the authorized lecturer and she is the master and gold qualified lecturer from International Sujok Association. And majority of us already experienced that actually when the knowledge is flowing through her, we receive these knowledges as directly from our beloved Professor Park Jewu. By memorizing Professor Park Jewu with a full love to our madam, Joshi's Kerala group is inviting all of you to this wonderful session. Smile evening and welcome, ma'am.
Thank you. Thank you so much. I have no words, but I can feel, I can sense your beauty, your mission to spread smile. This group is very beautiful group with great mission to help people. I'm with you. Okay. So today we are discussing very simple diseases. Just a moment. My video maybe. Okay. Can you see my video? On my screen?
No.
On my screen, I don't see.
We can see you only, ma'am. No screen sharing is there.
Okay. Yes, now I can see. So today we are discussing very simple routine diseases like spine pain, cervical pain, lumbar pain, knee pain, like this. It looks very simple. People think that, oh, this is very simple to treat. Yes, this is very simple to treat. At the same time, this is very important that you should not neglect. Like cervical, lumbar pain, these diseases generally people ignore only when pain is aggravated and it becomes acute, then they go to doctor. Mild pain, yes, dull pain, they don't pay attention. So now I want to say that Sujok is so beautiful, especially in treating all these diseases. Don't make it chronic. When a mild pain appears, you should immediately take action. Immediately. If you take action immediately, then this disease will not become chronic and also will not take acute condition. And also, like cervical, lumbar, these vertebrae, nerves connected with these vertebrae have great association with your internal organs, endocrine glands. So we should not take it just simply that, oh, today my stiff cervical is there, okay, uh, it will be okay. Maybe you don't pay attention. Uh, Here I want to mention that even the slightest discomfort, if you feel, you should immediately take action. You should be aware that this slightest dull pain can create some problem in future. If not in cervical, maybe some organ can suffer, some endocrine gland can suffer. Yes. So Sujok is so simple, especially treating these diseases. Of course, you can go to medical doctors if you like new people when they are not aware of Sujok. Uh, but I want to say one thing. Okay, all doors are open. You can go anywhere, wherever you want to go for treatment. But in home, first try this tip. If you don't get result, then you go to doctor. And I'm 100% sure that if you try and if you do in correct way, you don't need to go until and unless it is really some surgical issue. Yes. So now, Sujok, when we study about cervical lumbar, you know this, that hand, yes, just framework, outer framework, because some people are new. Just 5 minutes, I will give you glimpse so that we can understand all points. So let me share my screen. So we will treat all these points of cervical, lumbar in main system and in basic system and insect system or finger system. It is very simple and I will tell you how to treat practically. Some people, they know Sujok, still sometimes they fail to achieve the result because sometimes they find the point, but they don't know how to stimulate properly. Yes, sometimes they know how to stimulate, but point is not correct. So please pay attention. And today, if you have this kind of pain before sleeping, you should treat yourself. And tomorrow morning, I'm sure that you will see the result. Okay. So hand is similar to human body. This is the most beautiful sentence Professor Park Jae-woo he introduced to this world. And this sentence, when he said that hand is similar to human body, it is not just the outer shape. Yes, initially we are learning, but when we reach smile meditation in future, we will understand more deeper aspect of this sentence, that what is the deepest layer Professor wanted to say, that hand is similar to human body. Very simply, I can say, see, your body, this is the body. When we say body, this is the container, this is the cover. Your body is not just physical body, your body has metaphysical. Your body is holding infinite power inside. Your body is having inside body, there is unseen force, great force, and metaphysical. So it means we cannot neglect this body, we cannot neglect this physical part. This physical is holding grand metaphysical. Without this physical, we cannot experience this grand metaphysical. So we are very thankful to our body. So now when I said that hand is similar to human body, please understand this sentence. I'm making your base for future understanding when we talk about smile meditation. So when a professor said that hand is similar to human body, it means whatever body has, hand also has same information. So if our body is composed of soul, mind, body, life, like this body is not just body, it has soul, mind, life. Yes, so this body has metaphysical also, means your hand, when you see hand similar to human body, then it means that hand also has information of metaphysical world. That is why when you see pictures of saints, yes, when you see picture of great gurus, yes, like Sai Baba, yes, they're always blessing. They're always blessing with the hand, because hand has more of metaphysical. Physical part, just little we are studying. Yes, this is this point, oh, this is heart point, this is liver point. Yes, these are legs, this is eyes like this. So this is just, we are talking about physical. Now we have to penetrate, we have to take our consciousness to highest level to understand that hand can do miracles if we understand great metaphysical part of our existence. 99% is metaphysical inside and 1% is physical. But this 1% is so beautiful because this 1% is holding or carrying 99%. So we salute to this 1%. We respect to this 1%. That is why love your body, take care of your body. Yes, so Sujok is the great gift. You are practicing many therapies. All therapies are beautiful, but if you add Sujok with your therapy, you will reach grand perfection in alternative medicine, because this is very handy. And this has a glimpse of his world also. Professor Park Jevu used to say that if you are really practitioner of Sujok, then Sujok spirit opens the gate towards him. Yes. So, in all past sessions in this Kerala group, we have been discussing all body correspondence. But now, if you remember this sentence, just hold this sentence, that Sujok's spirit opens gate towards him. So if you are really practicing Sujok And if you're really getting the result, then be ready. This is the great time to reach heavenly world through Sujok. Yes. Now, let's come back to our today's target subject. Uh, First, we will discuss about cervical. As I told you, even if you have stiff neck, heaviness in your neck, take immediate action. You don't have tool in case, then of course, without tool also, you can just, without using any tool, you can stimulate your point and you can feel the efficacy of this system. So hand is similar to human body. This sentence I love to say again and again. Yes. So in coming time, you will touch highest dimension of this understanding that hand is similar to human body. And after understanding this, even you bless with the hand, you can do distant healing, you can bless, and you will see the miracle. So now, very simple. Where is cervical? Hand, when you see as body, yes. Even if you know this information, yes, with higher upgraded consciousness, try to grasp what professor wanted to say again and again. Hand is similar to human body. So when you see this body, central part, especially central part, this is trunk, this is squarish part, and from this square, 5 projections are coming. So when you see this hand, this part is square, you see palmar area, and from this square, 5 projection coming. Okay. Now, arms and legs are looking towards the earth in this standing posture. In hand also, when you hang your hand in natural posture, you will see middle 2 fingers representing the legs, side 2 fingers representing the arms are facing towards the earth, and thumb is looking different direction. So it is understood that, you see, when you focus arms and legs, arm has 3 parts, hand, lower arm, upper arm. Legs also have 3 parts, foot, yes, calf area and thigh. Now the beauty is that all 5 protrusion parts, when you observe, these 4 extremities have 3 parts. You see in Sujok picture also. Just like your main body extremities, your Sujok hand, middle 2 fingers legs have 3 parts, side 2 fingers arms have 3 parts. But in thumb, we have 2 parts. Why 2 parts in thumb? Yes, because in body also, this head is having 2 parts, you see, face and neck. So this gives us the understanding that thumb is representing the head area. So when you understand the similarity, yes, deeply you understand, as soon as you hold patient hand, first you should take it with spirit, okay, not just where is cervical point. Yes, I always appreciate when you do this treatment with great Sujok spirit, when you know hand is similar to human body. So thumb is very beautifully representing head, top part, and bottom is neck. So front, this is front, and face, front neck. Yes, and when you turn back view, when you see back view, you see nail. Your skull is hard. Yes, your skull is hard. Same way, this nail, you see, this is also hard, representing your skull. Okay, so this becomes your back of head. Now, because of this similarity, very simple to diagnose this point on the hand. You just need a simple glimpse that this is head, and you know then in body, below the head is the neck. So in thumb also, below this head is your cervical, your neck, back neck having cervical points. Now you can see here cervical area, yes, in main body. And where you will see the cervical area? Here, this is the cervical area. I will show this practical, but first grasp this idea. You see how beautifully our skeleton system is organized on the hand. So this beauty you have to absorb. This is not by chance. Yes, this is not exactly the same joints. Yes, same vertebrae. So it means this is message from God. He created this similarity. Yes, for a purpose, because when two things are similar, energy exchange is very good, very good. So this beauty God created on the hand, the creator of this universe. So this beauty, if you can feel, then you will enjoy doing treatment. So when you hold patient hand, first you see the hand, but then just for 1 second, from your inner eye, start seeing body on the hand, because it is true. You believe or you don't believe, but it is there. It is there. Initially, you start treating physical points, physical part like cervical, knee, liver, stomach. And when you will start getting results, then you will slowly, your consciousness will slip to higher consciousness. Then you will understand, wow, I'm getting result. Then it means this hand is more than physical body. Okay, now you see in your body you have chakras, you have meridians. Yes, we study meridians on body. So if hand is similar to human body, then we will also have meridian information, chakra information, also information of soul, also information of mind. Everything you will study here. So cervical point here, you see. Now when I will show practical, you will understand, but keep this picture in your mind. So this is a cervical area in basic system. Okay, so this is one area where we will do treatment, and second treatment we will do on the insect system. This is finger system. This is very simple, because each finger again representing complete body. Yes, because our body has, when you see central body, your central body has three main parts. One is a head along with the neck is considered as one part, then chest and abdomen, three parts. Yes, so each finger has three parts. Top part is head, center part is the chest, and lower part is the abdomen. Okay, now front, very easy to understand, which is front, which is back. So front, you see front part, we can bow down. In our main body, we can bow down, but back we cannot. Whether you see basic system or finger system, same idea, same pattern. So the area in this hand, when you see the front palmar area, you can bend, you can contract. So this is indication that this is front part. Okay, so in finger system, this is front part. So all front part of body is represented here. And then back view, this is your back view with your scalp, cervical, spine, everything back, on back. Whatever you see, you will see here. So which area, which point we will treat? So this is the point. Just top joint. Yes, first joint, just below the nail, just below the nail where you see the wrinkle. I will show on my hand in practical session. So this is your cervical area. So here you will treat for cervical. So this is one point I will tell you. You have to keep this picture in your mind, because whenever you are treating any one point, you should have the consciousness of full body and how this point belongs to full body. This is not just point. This is cervical point. This is lumbar point. Means this cervical, why this cervical point is here. So you should always remember that similarity. So the more you keep the similarity in your mind, you see your treatment will become very, will have great grand perfection. So this is the point where we will pay attention for cervical. Here again, this is focused picture. Yes, here distal joint, you can see below the skull. Yes, and the beauty is that this point, you will see not only on one finger, but on 8 fingers, you will see this cervical point. I will show. So you see, these are just pictures, but I will teach you on my hand. Yes. So this is how they have applied star magnet on this point. And this is how we have to apply magnets. Yes, I will show now with practical. And then also I will tell you, because here some participants are senior in Sujok. So I will also tell you how to handle in trio region and advanced levels. So let us first focus cervical practical on correspondence. So I'm sharing my screen. Just okay. Anyone who is having cervical problem, please pay attention. And if you don't have a cervical problem, then also pay attention, because maybe someone nearby or in your family, in your neighbors need your help. You can help them. Now you know, see, middle 2 fingers are legs, side 2 fingers arm, face, neck, chest, abdomen. So this is front view. Okay, this is front view. So where is cervical? This is cervical. So this area, see, here you can feel protruding bone. Yes, and this one bone and this bone. Find the central line. So now, how many vertebrae we have in cervical? 7 vertebrae. Sometimes in medical report, they mention, yes, they mention like some problem in like C4, C5, C5, C6, yes. So now we should know exactly where is C1, C1, C2, C3 like this. Okay, so everyone should draw with me. Okay, it is not difficult. When you draw, you will never forget. Okay, so Now, you see, when you learn cervical, this will not only treat cervical, but this spine, this nerves related to these vertebrae have very deep connection with the organs and your parts. Like cervical nerves, we treat when people have problem in the arms, hand, because connection with nerves, connection with the arms. And in Sujok level 1, we have a very famous treatment, that is 5-step treatment. On the basis of 5-step treatment, this Sujok science was medically recognized. Yes, and in that science, in all diseases, Professor Park Jewu, he taught us that in all diseases, you take any disease, whether it is liver or heart or knee pain, you should treat spine for sure, for sure. Even you don't have cervical pain or lumbar pain, you should treat all in all diseases, you should treat spine. So cervical. Now, this is central line. Now we have 7 vertebra. So this becomes 1, first vertebra, 1, 2. And then you come mark center point. Very easy to draw, you see. Starting, ending, and center. This is 7, sorry, C1. This is C1, and this is C7. C1 and C7. Then so first you make this point starting, ending. This becomes C1 and C7, and then you find the center, this cutting center. Yes, this is your C4. C4. Then this becomes automatically, this is 1. First you find first, last, center. Okay. Now in this gap you fill up with 2. So C2, C3, 4, 5, 6, 7. Okay. So this is very important because medical report. So if you have any problem in C5, we can go exactly. So this I made these vertebrae so that according to medical report, you can focus your treatment on the exact area. Okay. So after knowing this, when you start your treatment, I recommend that you do this ring massage. Is very important because warming up the area, this is very important. See, now on patient hand, we are not drawing this, but as a beginner, this is just for you. Okay, so as a beginner, you can draw, but once you practice on your hand, then no need to draw on patient hand. Okay, so this is how first you will do massage. Doing massage is very important. Warming up, blood circulation starts. Yes. So when you do this, and also you should do properly, not just randomly. Yes, you should do nicely. This is first step. But now, for example, if you have cervical problem and you don't have this ring, then what you should do? Okay, If you have, it is very good, because you see these points has multiple pointed parts. It can stimulate multiple points. But if you don't have, then you see, you have to warm up this area before doing your final treatment. So you can, rub this area. For example, now I'm not rubbing this, now this hand. So you rub nicely so that this skin becomes warm. Rub nicely. Now we are doing this practical session. I'm keeping one thing in my mind, as if I'm really treating my patient, and he should feel good, his pain should go. So that is why I'm focusing each point. You treat exactly how I'm showing. So because, for example, no ring, then you should first rub, and also you can do twist. You see, twist. Twist. Now here, don't twist the bone. I'm twisting the skin level. Little bit, you see, skin like this. So little bit bone is giving support, but main idea is to give twist on the skin level. Yes. So now like this. See, it is going like this. See, now like this. This sometimes this twist is enough. Like sometimes what happens during night time, because of bad posture, when you get up in the morning, there is stiffness. Yes, stiff neck. Sometimes pillow posture, or pillow is high like this, and wrong posture. So we don't need, sometimes we don't need to do complete treatment also. Just with twisting, you will see relax, relief. So you have to thumb, so you can do this twisting and massage on both thumb like this. And also we have foot. Okay, same pattern in foot also. Like in if disease is simple, then this one thumb, sometimes 1 point enough. But if it is chronic, then we should pay attention to big toe also. Don't neglect big toe. Here, yes, this is scalp area. This is scalp area. Don't focus this coloring, yes, but just focus the area. And this part is your cervical area. Yes, so you can massage this area also nicely, and then you can tie seat. Okay, so now second step, after doing massaging, after doing a ring massage or hand massage, now second step, especially if person has chronic problem, very chronic problem, then I advise that you do moxa therapy. Chronic patient should do moxa therapy, and then you find the point. Okay, but if it is not chronic, then you can do this. Now sometimes you don't have probe also, for example. Yes, actually you all should keep this, Sujok stuff in your, you should make kit. Okay, so if in case you don't have, then you can toothpick. So this you have to find that toothpick which is one side is not pointed. Okay, so this is pointed, this is not good, but now I don't have that toothpick. So you have to find that toothpick, back side is not pointed. Yes, it has ball kind of thing. Yes, so you can use toothpick if you don't have this. Sometimes I always introduce, this is in emergency if you don't have probe, though this is the best, probe is our main treatment tool, but I'm telling in case now you have cervical pain and in your home you don't have this, then what to do? So this, you see this part, I use this part. Yes, not pointed part. So I try to give pressure like this. Yes, on the point. Okay, in emergency when you don't have. Okay, so let's come back to our probe. Now, when you are finding the point, for example, in medical report, patient has problem between C3 and C4. So this is the point. Okay, this is the point C3 and this is C4. So it means you have to stimulate this area and this area. So you see like this. And better when before doing this rolling, better you do some pressing, and finding painful point actually is very important. So now you see I have marked the vertebrae, but sometimes this marking is little bit up and down. So better you stimulate nearby points also. If this is C3, you check nearby point also. See, I am telling you all minor details so that for sure you get the result. So you see checking. When you're checking the point, then you have to keep the probe in perpendicular direction, straight, and one by one check. Now, this is actually yang area. This is, and from C3 to C4, and also nearby area also you can press. Like we have taken the case, if this patient has problem between C3, C4, according to your case, C5, C6, you can take. Yes. And then I told you take a touch nearby area also. And don't jump from one point to another so quickly. And also this is yang area and bony. This is bony part. So if you press very deep, patient will definitely have pain. Even healthy person can have pain. So you have to be aware first. So when you are pressing this, you should know the limit, how much one should press. So keeping this bone in our mind, because this is bony area, you have to press, you should not press very deep, but little bit more than moderate. Okay. Now all these points will have pain. Even a healthy person will have pain. Then how to know whether this point is correct or not? So you should know that all people will have pain here because this is bony area. So you reduce the pressure, and even with the mild pressure, even with the little pressure, if you have pain, yes, like for example, yes, I'm not pressing very deep and ouch, very strange pain. If I have strange pain, then it means this is the main point. Okay. So now you have to check one by one. And sometimes you will find all points are paining. Sometimes no pain at all. So you have to be very smart. And sometimes person will say all points are paining, then you have to reduce pressure and you have to reach the conclusion. You have to give mild pressure, and in this mild pressure, whichever point is giving very strange pain, you should select that. And you see the gap where I have made these cuttings. Don't neglect the gap. Check one by one and don't neglect the gap. Okay. Now, for example, ouch. Yeah, patient said, oh, this is very painful. Now, stop here and now you do rolling massage. Okay. After finding the painful point with perpendicular direction of probe, now next you should do rolling massage like this. Whichever point you have searched, you have to do rolling massage. Sometimes there is no medical report at all. Now, if you go this technique without medical report also, you will know that which vertebra patient is suffering. Okay. And then you can start doing treatment. After this rolling, if your point is correct, then after 1 minute, patient, you can ask from patient, how are you feeling? How are you feeling? And patient, if he says, oh, I am feeling better. Doctor, I am feeling better. Yes, I can move. Even 5% relief he gets, then you should tie seat. But if he does not, what people are doing, why they don't get result, this is the main point. They do good massage, yes, and ring massage, everything they do, and then immediately they tie magnet or seats. And maybe out of 10 patients, maybe 2, 3 will say, no, not getting result. So you have to be very sharp. If you invested your time, you did massage, and then you should ask before applying seed, you should ask your patient, how are you feeling? If 5% also he says, doctor, oh, I'm feeling little relaxed, it means then this point is correct. Then you will apply your final seat here, your magnet here. But if this person says, oh, not even a single percentage, oh, no relief at all, then don't apply seed here. Don't invest more time here, because this point is hidden somewhere else. You understand? You can treat all cervical diseases, all cervical, all types of cervical, if you remember all these minute points. So then you should come here on this thumb. Okay. So at least before applying in Sujok therapy, not only cervical, in all diseases, before you apply seed, after doing massage, you should check, especially in pain condition, you should check. If patient says, oh, my little bit relax, then you will apply seed. Okay, this is very important point. And if patient says no relief, then why Professor Parkji has given different system, main system, insect system, mini system, then we should work on another system. You should have patience. Don't finish, because one time you do treatment, one time correctly you do treatment, maybe second day he does not need at all. So with smile, with patience, you should do. Okay. Now let's come to insect system before I tie seeds. So insect system, you see all fingers, and below the nail, the first joint here. So this is very easy because small area, scalp and this wrinkle area, this part is your cervical. Just one magnet enough. So all these fingers, this point. After seeing this, no one should have cervical problem. Okay, follow all steps correctly. So this point, yes. So this is the area, and this is wrinkle area. You see, wrinkle area. Now, here again, you have to do ring massage. So if you have this ring in your home, you should always keep this ring in your home. Okay, so sometimes I have noticed that just by doing ring massage, their pain is gone. There are many types of patients. Some patient needs good treatment. Some patient just 1 point, some patient 2 points. Yes, two correspondence system. Some people just twist, they are cured, and some people just ring massage, they are cured. But I have seen that if pain recently started, you just do your twist massage or ring massage, maybe he does not need further treatment. So now you know these are the points So if you are treating your patient, you can give this ring to him and you can tell him that here you should do your ring massage. Okay, chronic problem, 2 to 3 times a day. Yes, few seconds on each finger. Don't press hard. Yes, don't press hard. You have to create a kind of frequency, not pressure with the ring. So you will do this ring massage on all the points. And now, if chronic, also you can do moxa. So this center point here, now this is, now see, I'm pressing, I'm feeling pain. So when I'm feeling pain, it does not mean that, oh, this is painful point, because in our Sujok, we say, find the painful point before applying seed. So now I don't have cervical problem. I'm pressing and I'm getting pain. Moxa. Someone has asked moxa. Moxa is like shigar like. Maybe next time I will give full demonstration of moxa, how to do. So this is long piece. I will show next time. Okay, but moxa is like we are giving heat to the point. And after burning this, it is like a cigarette. After burning this, we are giving heat to the point and it is not touching the skin. Okay. So what I told you, that you see now I pressed and I'm getting pain. Now what is happening when you're doing treatment on patient hand and patient says, doctor, ouch, this is pain. And you become happy. Oh, I found the painful point. I found the painful point. And then you immediately you do seed therapy and treatment. And then as a result, sometimes you don't get result also, because this is not a real painful point. This is the point why this was paining, because this is bony area and I pressed a little deep. Okay, so here, because this is bony area, you have to check one by one. And if I want to say, if this point is real, Sujok, from Sujok point of view, if this is a real painful point, then even with the mild pressure, double check, even with the mild pressure, this point is painful. Okay, so you have to check all with patience, and better you check in perpendicular direction, like this, one by one, with patience. And nearby also. And you should tell your patient before you press, you should announce, you should tell that I'm pressing this point and you will get little pain. Yes, you will get little pain. So you have to be ready. And if you find the strange pain more than moderate pain, then you should inform. Actually, if you are doing correct treatment, before patient informs, his body language will tell you that you have found the correct point. Ouch, maybe some voice, ouch. Or maybe, body language will, like this. Okay. For example, I checked all points and now you say, ouch. So this is the main point. So I will do treatment here and I will do treatment here. Okay. In case no result, then you will jump same pattern. You will do on right hand. Okay. But now I'm showing on left hand. So now we have done effort, ring massage, probe massage, finding points. Now this is time to apply the seed or magnet. So magnet also you can apply. So this is star magnet. Or you can apply, if you have star magnet, you should have in your kit. So for example, I got pain here. star magnet on this point. Just 1 point enough. Just 1 point enough. Okay. And like here, now I can, one sample I can show with seeds also. You can apply okay. So you see, you should not press, because as I told you that each person threshold is different. Some people have very sensitive skin and soft hand, and some people have hard skin. So you have to be, you should have that kind of consciousness. On each hand, you need different kind of pressure. Okay. And this is also one kind of probe you can do. So don't press very deep. Now, you can use black pepper, you can use green lentil, you can see here. So for this, and better, we add surrounding points also. For example, 1 point, like for example, I found, I will tell how much time, just have patience, I will tell everything. For example, C4 is the main point. Here patient is getting main pain. Now what I do, sometimes I combine magnet and seed also, like this. See, this point, this magnet will touch, this magnet will touch C4. And additionally, now we have different size of magnets also. Small size is good, actually. This is big size. I'm looking for small size magnet. This is small size. So this magnet will touch the main point, and additionally surrounding points you can do like this also. And when you are applying this green lentil, this white, this eye of the seed will touch the skin. You see this eye, you can see this eye. So this is surrounding point, and this magnet will touch the main point. Sometimes you can do like this, or only seeds, or only magnets. So you can tie like this, and then you can roll. Okay. Then 6 hours, you can tell your patient to keep these magnets or seeds. Okay. So 6 hours, and then they can remove. But next day when you're doing treatment, make sure that their skin is in correct condition. You can do on the other hand, and you have to be, you have to be aware. Don't create any wound, and don't create extra pain for patient. So, and this is your insect system, and foot also you will treat here. Now sometimes you see, sometimes you don't know the point. Like if you just know, like you know that person has cervical problem, and you don't know the point, and you don't have time also. Yes. So sometimes you can try this also. After doing ring massage, you can tie. If you have time, then better you do it very systematically. If you're in a hurry, then something is better than nothing. Do something. You can apply all seeds like this. And you have to tell your patient to massage from time to time. So this is how you will treat cervical. This is simple tip. And now I want to tell you triorigin point, very effective with this. In right hand. Yeah, knee pain point. Okay, I will tell knee pain also. So in triorigin, please pay attention. This point you have to treat on the right hand only. So first, if there is some nerve related pain, okay, this is thumb. Yes, this is thumb. You see, this is yin yang line. And see, this is the bony area. This is the bony area. The same come to this same level of bone. And when you reach this yin yang line, see this, the base of this line. Just pay attention. First point is this. This is triorigin approach. First, we have 6K approach, we have triorigin approach, but okay, this is easy, more easier than 6K also. You can pay attention. So you massage this point and apply one seat. So we have steps. We have 3-4 steps in this. Though main insect system and main system is good enough. Only in special cases out of 10 patient, if you don't get see the result, then you add this. Otherwise, main system, insect system is good enough. Okay, only in special case you will add this. So here you will massage and apply one seed here. This is step number 1. Okay, then step number 2, you will come to, this is very systematic. You cannot just randomly jump to any finger. So after this step number 1, you will come to index finger, this joint. This is hetero joint, this joint. In this joint, you have to, you see, this is yin yang line. This is yin yang line. So here, this point, second seed you have to apply here. Yes, second seed you have to apply here. Okay. Now, third seed you have to apply here. Third seed here. Okay. This is third, number 3. And so this is actually 4th seed, but very systematically I will explain. 4th seed you have to apply here. After massage, okay, again, this treatment you will add in case some difficulty, yes, not getting result, and this is higher approach. Again, step 1, right thumb. This is available only on right thumb, not left thumb. Okay, so this is some calculation. This treatment is based on the triorigin forces consciousness. So step 1. Then next is in this finger, step 2. Then step 3, exact center, seed number 3. You can apply fenugreek seed, yes, in all these steps. And step 4, here. Finish. Okay, so you can add this along with your correspondence treatment, whatever you have done on the left hand, like this. So this is cervical. And now I want to show lumbar treatment. And now before I go to lumbar, I recommend that every day you should, when you get up in the morning, you do massage like this. Yes, because in our Sujok basic system, this is your spine starting from here. Yes, like this. This is very good. All you have to massage all tips of brain. Make a habit. Okay, when you get up in the morning, you are doing yoga exercises. So this does not need special time. Even you are watching TV or walking. So massage all tips of the brain, tips of finger, because this is brain point. Yes, and then massage cervical. Yes, if there is numbness in the arms or legs, it will help. And then come to this. Though you don't, I have not told you thoracic, but you just come down in that same direction, this massage, and then your central line. Yes, so 2 to 3 times on both hand. If you massage, you will feel very energetic, very, very energetic, even if you don't have disease. Okay, now I want to show lumbar. So I will share my screen. Let me show first PPT. Where is lumbar point? Back kick. Sharing. Again, lumbar, very important. Now see where is lumbar point. Very beautifully organized. Beautiful, wonderful creator. So he created this hand so beautifully. This is cervical, thoracic upper, thoracic lower, and this is lumbar area. This is lumbar area. So we have to focus here. We have to massage. This is yang side. Yes. So this is the area where we will do treatment in basic system. This is lumbar area. Here we will do treatment. And in insect system, lower part, here we will do treatment. You see this line, this is ending part of the finger. So just above the line, very easy. Even if you don't know full spine also, just remember last line of this finger, back view. This is nail. This is nail. So this is back view. And here you will do treatment. For sure you will get result. See? So lumbar 1, L1 to L5. So you see this is the last line. Last line means this is L5, L5. So you can see this is L5 because in this finger, this is last line. So it means your lumbar 5 is here. This is lumbar 5. Then you know, go one step up, L5, L4, L3, L2, L1. Okay, now you should know L1, L2 because like medical report, patient has some problem in L4 or some compression of nerve between L3, L4. So if you know correctly, then you are focusing exact point. You see why we should know accurate point. When you are doing seed therapy, then it is okay. You can put extra seed also. But sometimes in some acute conditions, sometimes when we do acupuncture, then we cannot put more needles. That is why for this purpose, you should know exact point. Seed therapy, additional also you can put, no problem. So this is the area where we have to pay attention. And I want to say one thing, that this lumbar area is very special area additionally, we have to treat this area if people have lower problem, legs problem, knee problem, any problem in the legs. So this lower part we have to treat, even sciatica pain. Yes, so this lumbar problem is this lumbar treatment is very important for legs diseases, for hip pain. Yes, any problem which is in lower limbs, we do this treatment for sure. Even this person does not have lumbar pain, even in heel pain, but we have to do lumbar points along with the heel point. Okay, so this is the area where we have to pay attention. So let's focus. I will show on my hand also. And don't worry, because I want to cover all points correctly. And if we don't finish, I don't want to rush. We can continue this subject. But I want that you should fully understand, and 100% result you should get. This is our mission. This is our pure mission, not just delivering knowledge. Yes, that is why I give with this intention. Lumbar area in main system. So this is the area, middle two fingers, legs, and in foot, this is toes. And here is lumbar area. You see, lumbar area. Okay, sciatica also we will discuss, don't worry. So in finger therapy, as I told you, now not only one finger, but all fingers will have lumbar points. So this is the area. Okay, you can take screenshot also. So this is the area where we have to treat. So this is according to basic system, and this is insect system. Okay, so let me show you. We have time, don't worry. Maybe we will finish all 4 topics. So now I am sharing my screen to show practical part. Just a minute. Sharing screen. Okay, see. Now, what is the rule? You know what is the rule? Whenever you're doing Sujok treatment, what is the rule? First rule, massage, warm up. Yes, this is first rule. So if you have these tools, is very good. You can do. And if you don't have, then manual massage. In main system, I like to do manual massage. But please pay attention. Don't press very deep, because we have nerves here also. Yes. So press depth, deep, but moderate. More than normal, but not very deep. Normal means, see, this is normal, but little bit deep, but not very deep. So you have to massage like this. So now you should not have nails for this. Okay. So after doing good massage, all chronic lumbar pain, I recommend moxa therapy for sure. Okay. You should do moxa therapy. Now, please pay attention that this lumbar pain, of course, for lumbar pain you will do, and also for sciatica. This is for sciatica, you will add this step also. With sciatica, we treat leg point also, we treat UB meridian or GB meridian, but this is also one step in sciatica treatment. So when I will introduce sciatica, so I will not show this again, because now you can add this in your sciatica steps. So now we are treating lumbar pain, backache. So you can do massage. And how to find which vertebra? In case medical report, please pay attention. Now I will draw on the hand if patient has problem in L4, L3. Yes, Then you have to go very systematically. Then how to draw this? How to draw this? So now first we should know this wrist line. So this is wrist line. On patient hand, you're not drawing. This is just when, as a beginner, when you are learning. Yes. And central line. Between two legs. Okay. Between two legs, this is central line. So we need this central line. Then you have to divide this line into 3 parts to find exact lumbar area. So this is our line. First, last. And then you divide this line in 3 parts. So this becomes your lumbar area. Okay. Now, how many vertebrae we have in lumbar area? 5. Okay. So this becomes lumbar 1. Then this becomes lumbar L5. Okay. And then in between, you will add 3. 1, 2, 3. So this becomes lumbar 2, lumbar 3, and lumbar 4. 5 vertebrae. And now see medical report. Compression between L3 and L4. Yes, some situation in L2. You can give more attention on that area. Okay, sometimes one magnet enough. One magnet. If you are a very good researcher, you can find accurate point. Sometimes just one magnet. But we are beginners, then we are putting some for supporting our treatment additional points so that we don't miss. Now one by one, now you see when you hold this probe, don't massage with the pointed area because this is here, you see, because of flesh. Yes, if we do with pointed is not good. So we need little bit big size of ball. So we can start massaging, and be careful that because we have nerves here between 2 fingers, and here is 2 bones. There is a depression here. So you have to be careful like this. Not very deep pressure, but as I told, it is not very light also. It is more than, little bit more than moderate. You have to be aware of this. So after doing manual massage or this kind of massage, then we try to find a point. With patience, if you don't have medical report, you go one by one, check all points. And if you don't find painful point here, then you go to right hand. Okay. And each person will have different kind of threshold. Sensitive skin, old age. Yes, you will see in old age, many wrinkles are there. So don't do like this. If many wrinkles, maybe this is not good type of massage. Then you do general gentle thumb massage. Yes, gentle thumb. If skin is soft, delicate hand, then don't use this on basic system. You can do manual massage and you can apply. See, actually in my practice, I do manual massage and then I tie seeds. But main effort I like to do on insect system. Why? Because as per similarity principle, vertebrae are bony area. And here in main system, massage is good. These points are between 2 bones in the depression. But this is bony area. Okay, so this is nice for vertebra because vertebras are bony. So here, as I told you, this last line, it becomes L5 and below this is sacrum. Because you see your finger is ending here. Yes. See, moxa you can do on spine point. We are not doing like I saw a message now, high BP. If this person has high BP, you can do moxa. You're not doing moxa on the points of heart. You're doing moxa on lumbar area. Okay, so no problem, you can do. And here, your finger, see, this is your finger, and your finger is ending here. So insect system also, when you see body on the finger, this is the last point of your body, center body. Yeah. So now here your, when you see this line, this is the area where lumbar is finishing, and below this is sacrum area. So this is very important, especially I told you in sciatica and all leg diseases. So this becomes L5, and here you know L5, L4, L3, L2, L1. Okay, so this general idea is also enough. So you can massage this area. This is central line. Seed therapy, you can add extra one seed also. So see, one by one, check with patience. And this checking you have to do to save time. I'm demonstrating only on one finger, but you should do this checking you should do on all fingers. But your effort decreases when patient says, oh, doctor, my pain gone? Or yes, I am feeling little comfortable. Now I can move, or my pain is decreased. Then you don't need to go to next finger. Okay, that is why you do very nicely, perfectly, with patience. You never know, one point can treat that patient. But sometimes jumping quickly from one finger to the other finger, and then you can miss the point. And even if you treat 10 points, result is not coming. Because of this reason, even many people, after knowing Sujok, after studying thoroughly, they miss this and they don't get result. So patience is very important. Smile is very important. Love is also very important when you hold patient hand as if you are a mother, and your patient, no matter what age, is your child. Yes, because touch therapy, yes, you hold patient hand with smile, with love, and actually we are not treating patient. Actually, we are not treating patient. We are creating environment in patient body. When we see from smile meditation point of view, we are just creating environment in patient body so that his own healing power can open. So this is the area. One by one, wherever you find a painful point, you can apply target magnet on that area. So with the help of now this paper tape, so if you don't find the painful point, okay, do something, at least tie this seed. But I recommend that better to find painful point. Extra seed also you can tie. Fenugreek seeds are good also. So see like this. You can tie fenugreek. So this seed actually rolls down. If skin is dry, then this seed will stay. But if skin is not dry, then I recommend you use star magnet or fenugreek seed. On yank surface, we can use fenugreek seed also. So you can tie like this. Okay, so now you know. And if you choose this, and one information I want to add, I like treating this little finger for lumbar problem. little finger, just below the nail. This is as per this is as per mini system. This area you should stimulate nicely. This one, and also in foot. Just a moment. I will show foot. This is very important for treating lumbar pain and leg pain. I like this point very much. This is a little toe here below the nail, and this is very sensitive. Even if you press with little pressure, it is very painful. Anyway, according to the patient threshold, you will massage this area, and you tie fenugreek seed, bunch of fenugreek seeds. You can, after doing good massage, you can tie. And you know that also here is UB meridian ending point. This is very good in all kinds of lumbar pain and leg pain. This is very good point. Okay, so here you can tie seed, or extra seed also you can put. So it means below the nail you have to massage, and don't leave this line and all this area from here to here. And very, very effective point in lumbar pains and leg pain, also in knee pain, all kinds of lower pain. Additional, this is supportive point, not final point, but supportive point. Okay, so you will do this kind of treatment. Now now you know lumbar pain in main system, in sex system. Let me focus triorgan, and then I will tell you sciatica, because sciatica also is related to lumbar, and we have already done lumbar points, so we can immediately do next phase also. So let's see this point, sciatica. First I will show presentation. Sharing screen. Oh, sorry. Once again, sharing screen. See sciatica nerve, how this sciatica nerve is formed from L4 to S3. That is why we have to treat lumbar area. Why I told that you should treat lumbar area in sciatica disease. So not only leg. So you have to treat this, and then you have to treat this area also. So now this nerve, you see, this nerve center back of calf muscle, also some part in the side area. And in back UB meridian, when you know, when you study body meridian in TCM, you know that back this is UB meridian and side is gallbladder meridian. So you have to see, first choice are always with lumbar points. Now you saw lumbar points, definitely you have to add lumbar points, and then you will work on the meridian also. So lumbar points you have seen, these are lumbar points we just did, and foot also, like foot also between two I will show how to put in main system. Dry pea seeds are also very effective for lumbar pain. So anyway, idea is that for sciatica you should add lumbar treatment also. Here this is lumbar point in hand and foot. So finger lower part, all lower part we understood. And yes, this I wanted to show. So sciatica, now this is UB meridian. Okay, this is UB meridian. And actually maximum, here I want to tell you, maximum part of your back is occupied by UB meridian. So not only back of leg pain, but in all back diseases. Now, because I will show you now UB meridian. So in all kinds of back problem, if you know where is UB meridian on Sujok platform, or we say Biol meridians. Yes, like in TCM, you say this is traditional classical meridians. But in Sujok, when it is transferred on the hand, because all meridian knowledge we have on the hand, whatever you study in on body level, because hand is similar to human body, so our body has meridians, and when we transfer all these meridians on hand, it is called Buell meridians. People, those who have TCM knowledge, for them it is very easy to grasp. Very easily they can understand these Sujok Buell meridians. Very quickly they can understand. So this is UB meridian. Now, sciatica pain from back, lumbar, radiating towards legs, we have to work on UB meridians. Now, where is UB meridian? Now, this is full story, but I just want you to focus. Where is UB meridian? Just you should have this idea. Now, you see, this is index finger. This is middle finger. So, each finger, back side, this is nail side, will have 3 lines. So this middle finger, when you just imagine 3 lines, and here, because here we have beginners, so I cannot go in detail, just because we want result. So even you don't know meridians, just focus which line. Okay, this is not very difficult. This is objective type of treatment, means even you just know the point or line, you can immediately start doing treatment. So you see, this is nail. Yes, and imagine that middle two, you know that this middle 2 fingers are legs, and you imagine center line going. Yes, and now if you are imagining 3 lines on the yang side of this finger, the line which is near the central line, you have to choose this. That is why I made this central line, so that you can select which line. Okay, so we have 3 line, you see, 1, 2, 3. The line which is near the central line, this line is UB meridian. So we have to work on this. I will show on my hand. Okay, and second option is, you see, this is gallbladder meridian. Now, like if patient says that my pain is radiating towards the side of the leg, then we have to work on gallbladder meridian. This is very famous meridian to treat migraine, you see, in pathway diagnosis. If patient has pain in these areas, then you have to work on UB meridian. Similar way, if patient has pain in this area, like this is one side, but when you see second side, this right side also, same thing is there. Only thing is, if person has left sciatica and left side pain, then we choose left hand, and if person has right side, then we choose right hand. And here is the UB67 point. This is the last point. This is the corner of this. This is very small point near the nail. As I told you, this is little toe. You have to pay attention. One seed. Sometimes one seed is enough. Okay. So after showing these pictures, now how to do this practical part. Gallbladder meridian is here. Like UB meridian, you have understood. UB meridian was near the central line. But gallbladder meridian is very easy. Middle finger, central line, exact center. You see, exact center. So, exact center. This is our treatment line. Middle finger, exact center line. So, means if person has left sciatica, you do this treatment on left. If right, then you do treatment on the right. Okay. So now I will show practical part. sharing screen. So you have understood how to treat lumbar. For sciatica treatment, lumbar is very important. So if person has lumbar pain, already you're treating lumbar. If person has sciatica, even this person does not have lumbar pain, yes, then also you will do sciatica lumbar treatment. Now, this for normal lumbar pain on main system, this dry piece is very good. You can use green peas, dry peas also. You have in your kitchen, green or yellow. Okay, very easily available in the market. Because here we have depression. So this seed is good. Okay, so here, see, everyone should try. You will definitely get result. After doing all those massage techniques, you should apply this. And then tell your patient to press more often. Pressing is very important. Okay, so you have understood lumbar treatment. Yes, before showing sciatica slides, I already explained how to treat lumbar in main system and insect system. Only thing is, if left side problem, you will do this treatment on the left hand. If right, then you will do treatment on the right hand. Now, I want to focus sciatica nerve in correspondence area first, and then I will talk about meridian. Now, as you saw in picture, hip area, first lumbar, and from lumbar, nerve is coming out uh, and crossing towards the hip and then coming to the legs. So, here, yes, so this is actually in basic system. After this, I will teach you knee pain. In basic system, this is knee point. Okay, this is knee point. Here, knee point. Okay, so now I'm not teaching knee point. My main idea is that I want you to understand that if this is kneecap, yes, then because we have to reach calf muscle, so this can become landmark. It will help you to understand that which is front part of leg. Like in your legs, you feel knee, where is knee? And what is below the knee? What is below the knee? Below knee is your shin bone. Okay, below knee is your shin bone. So just behind in your leg, just behind the shin bone, you have calf muscle. See, behind, exact behind, this is your calf muscle. Okay, so now here, this is kneecap, knee area in basic system. And this becomes your shin bone. Because you see, go behind the knee, just go behind the knee and come down. So if this is kneecap, then go behind the kneecap. So this becomes your calf muscle area. Okay, so you should know this. Why? Because this is your calf muscle area. Means, easy way, that if you have understood this central line, now easy way to understand. If you don't know kneecap, then another way to understand, this is central line. Okay, so imagine this is complete central line. So your sciatica nerve, correspondence of sciatica nerve is near the central line. Okay, two legs, side two fingers are arms. So between two legs, this is central line, and your sciatica nerve is near the central line. That's it. Now, if person has left leg, so this near the left thumb, this territory is left. So you have to treat here. If person has right sciatica pain, then you have to, because this is right thumb, near the right thumb. This middle finger is your right leg, because we are taking primary correspondence. Okay, so left leg, this is your main finger. Left sciatica, this is your main finger. Right sciatica, this is your main finger. Okay, then here, now when you reach the finger, then you imagine central line, and here is your, near the central line, this is your sciatica nerve. This side is your sciatica nerve. Okay, and if you close your fingers, you see, you cannot see this nerve. I hope you understood, everyone. Okay, if you do it correctly, you will see the result. So this is sciatica nerve. After giving attention to lumbar points, then you have to give attention to the nerve, sciatica area, nerve area. So very nicely, you should massage all this. Sometimes pain is coming in the heel area. Now here you can observe heel also additionally. This is heel. Heel point. Anyone who is having heel pain will do, just some people just heel. I'm not talking about sciatica, because in some people can get heel pain also. So if you have heel pain without sciatica, then also you can treat this. So this is your heel. So same technique, you have to massage. Yes, and after massaging, you have to find points and apply seeds. Okay, good massage, seeds, and don't leave treatment until you are fully cured. Means one day you did it, and allow your seeds to stay for 6 hours. Then next day you can do again and continue this treatment till the time you're fully cured. Generally what happens, like one day you have done treatment, and second day sometimes you're not getting result and you give up. No, you should not give up. Maybe you should try on the other hand. So anyway, let's come back to sciatica nerve. So now you know that this is your left sciatica nerve. Right sciatica nerve, right hand, middle finger. This is your middle line. And then this is your right sciatica nerve. Yes, this is your right sciatica nerve. It means near your ring finger is near the sciatica nerve. So you can keep some landmarks. So your ring finger is near the sciatica nerve. Now, after finding the points, massaging nicely, yes, nicely massaging. And in this case, I highly recommend that with hand, you should do foot treatment. Foot treatment, because you see, if patient has problem in the lower parts, so foot is very close to the lower parts. If patient has problem in the upper part, then hand is very close to the upper part. So, and in this case, in all leg diseases, yes. So I have heel pain. I saw the message. Yes, you can do. Now start at least for all heel pain, knee pain. Now you know heel point, knee point. Do lumbar point, heel point, you know. Yes. And kneecap also I told, massaging here, this part, and knee. After this, I will show separately knee point. So just focus this. Okay. So foot also, where is sciatica nerve? Middle two toes. This is your left foot. So where is sciatica nerve? So now this I cannot open, but you have to do copy paste. Yes. So middle two, middle finger, like near the ring finger. So here also middle finger, middle toe. And here, if you open, here you will find, if you open here, I cannot, this is, yes, here in this inside, here, this is your sciatica nerve. It means exactly whatever you are doing on the hand, exactly you have to do on the foot. So now see how I apply, how I do seed therapy. So fenugreek seeds, you should make thin chain, sleek chain. If you are applying this, if you are using these seeds, just single chain is good enough. You can apply this. Actually, I like to apply sleek chain. Exact point is important. If you know exactly, so very important to apply seed on the correct. So single line or this seed like this. So to save time, I'm just making small chain. Otherwise, until here, because this is sciatica nerve. You will apply here. You have to do massage. Yes, you have to do massage. Don't forget lumbar points and this chain until here and paste like this. Same in the middle toe. In the middle toe, open and similar way, paste like this. Good massage. Okay, and this toe, if patient has sciatica problem, you should massage this toe, this central line very nicely. Massage at least for 5 to 7 minutes, sometimes 8 minutes, 5 minutes like this, massage and then apply seeds. Moxa is very good in chronic cases. You can do this. Okay, so this is correspondence treatment. This is correspondence treatment in sciatica on hand and foot. Now, if patient gets relief, it is very good. Okay. And you can also try meridian. If you are confident with meridian, you can try first meridian, because in meridian, you don't need to do so many steps. Just one bar magnet is enough. And if the patient gets relief with bar magnet, maybe you don't need this long treatment. You can do some add foot treatment, but you don't need to do long treatment. So now, bar magnet, we are using this bar magnet. And in case you don't, I many times I tried this also on my patient, especially in emergency, if I'm outside in some outside, not in my clinic. This is, electric waste wires. Yes, in Diwali, now all wires I collected, waste wires. See, colorful wires. I keep this in my treatment kit. So easy, no expense. So this is actually, bar magnets are good, but this you can do. Only thing is bar magnet has correct indication of North Pole and South Pole. But here we don't have, though actually everything here, everything will have North Pole and South Pole. In bar magnet, we have indication. Here we don't have. So we have to be aware and alert while we are using this. Okay, now how to use this? First, if person has a problem in back view, calf muscle paining, back view, so this is UB meridian. Okay, side line. I explained already on the slide. Yes, this is UV meridian. So in pain condition, now you just see there actually we have lot of details for using this, but as a beginner, you just see and apply. Now you should apply first on this joint. You have to keep, you see this center part of this bar magnet, center part of this magnet, you have to, the center point will touch the joint. Yellow will face this side and why it will face this side. So be aware. First, this is our first choice. Pain, we are doing sedation. This technique is called sedation. So with the help of uh, this tape, we should apply. If person has sciatica pain, you apply first step like this and wait and check. 1 minute, 2 minute, check, check, check. And then ask your patient how it is working. If patient says a relief, then very good. Then you fix this magnet and you will tell your patient that if your whenever your pain is gone, you remove magnet immediately. Don't keep this magnet while sleeping, whether you are sleeping in daytime or nighttime. We don't recommend. You can remove magnet as soon as pain is gone. And then if pain comes back again, you can apply this again. Second day, pain is there, apply same technique. Okay. If pain aggravates, if some patient says my pain discomfort is uh, increased, then you have to reverse the direction. This is called tonification, but anyway, you reverse the direction and then see. Okay, then see how it is working. Okay, and still if it is not working, then as a beginner, you just do correspondent treatment. Though we have advanced technique, 6K trihydrogen, but now you can do this. And if person says that my pain is radiating in the side of the leg, in this case, you will apply here, exact center. This is called sedation of, this was sedation of UB meridian. Exact center means sedation of gallbladder meridian. This is sedation of gallbladder meridian. And if person says pain is aggravated, then you will change the direction. Generally, this gives relief. Mainly first choice is UB meridian sedation, because I prefer doing this. Only in special condition, if patient says that, and sometimes you will see that patient is saying that I am having pain in backside also and side also, then first choice is UB meridian. And don't forget, I told you this point, this little toe, this point. Okay, so this is actually this yellow, this is this is north south pole. Yellow and white is considered as north pole. Okay, now if you don't have this, then this is wire. Now this here we cannot recognize north pole and south pole, but in your home you can find waste wire. Yes, waste wire, and with the help of paper tape, because here we don't know north pole and south pole, but we can try. We should not put lot of tape because it obstructs the energy flow. So you see, take this waste wire and you apply on the meridian. After diagnosing, just apply and check, because here you have to check and wait for a minute, 1 minute, 2 minutes, wait. If patient says my pain is gone, keep this. If aggravates, because we don't know north pole and south pole, what you will do? If aggravates, reverse. Okay, reverse, and you do this way, reverse. And then you can create a mark. You can color this one corner, because next time if patient wants to, after 2 hours, maybe like pain has gone after application, maybe in 10 minutes pain has gone, and you have to remove immediately. But then after 2 or 3 hours, if patient says that pain has come back again, then, because if you have done marking, like you can color this black, so you know that my black is facing this side, so that you apply correctly. Okay, and if person has pain in the side of the leg, then you have to try here. Okay, in center line. This is gallbladder meridian. This is gallbladder meridian, and same pattern. If aggravates, you will change the direction. Anyway, but beginners, if you can do, why not? You can do even if you don't have knowledge of meridians. You just try and see. In many patients, you will see like out of 10 patients, 4 5 patients will respond to this meridian treatment very quickly. You will see they respond, they are very sensitive to energy treatment, and some people will respond to correspondent treatment, and some people they need both. Okay, so this is how. And also I have I think I have sciatica video, old video. If I will find, I will send to you tomorrow. Not today's video, but old video I will find. Okay, now I want to show knee. We have less time, but we can cover knee. I want to show knee point. Slide. Okay, let me show this slide. Calf muscle area, I told you where is the calf muscle area. Now massage. Wherever you have problem in the correspondence area, you massage and you apply seat. Okay, now I want to show knee. Okay, sorry, share screen again. Yes, so just observe this. Where is knee point? Kneecap area, I told you. Kneecap, and I will show on my hand also. So this is the area. You see how they are tying fenugreek seeds. If you know the exact point, it is very good. Then we don't need many seeds. But if you cannot find exact point, at least do something. Something is better than nothing. So after doing good massage, paper tape, fenugreek seeds, and you can tie on this joint. In insect system, you see here, middle joint and lower below the joint on the yin yang line, this is the knee point. And I told you that in all leg diseases, this point is very important. Little toe, yes, this point is very important. And also like if sciatica pain, as I told you in previous chapter, gallbladder meridian is affected. If side meridian is affected, then tie one seed here, fenugreek seed here. This is very effective point. Yes, if meridian treatment. Okay, now I will show knee point last. Knee pain, very common, but very easy to treat. First thing is, it will cure for sure. Okay, but first sitting it will cure pain, and then after that you should not stop treatment. Especially in chronic cases, you should, even your pain is fully gone, I recommend that continue. If this is very chronic problem, like in first 2-3 sittings, if pain is gone, don't stop treat. Still don't, because you have to heal completely. You continue this treatment at least for 14 days or 1 month, so that this problem should not come back again. In acute cases, no problem. 4 sittings, enough. Okay. Knee pain. Now here is a tip. In knee pain, this is in basic system, this is your knee, but you will advise your patient to do ring massage on all central joint of each finger. Okay, see, all, not only just this, because of insect system. Yes, insect system also has knee point near this joint. So start massaging all middle joints. And then according to level 1 also in basic system, as per reflection theory, we have reflection theory. We will have points of knee here also. So I'm not explaining that. That is little detail subject. But final tip is that you massage all middle joints of each finger. That's it. Okay. Of course, we need main point. Okay. But massage, from massage point of view, all middle joints. And if you don't have, then you have to. First is legs. You start with legs because knee belongs to legs. So we should start. So this is left knee. In left hand, middle finger, middle joint is left knee. In right hand, middle finger, middle joint is knee. You will get result today. Especially pain, definitely you will sleep very comfortably. So you do good massage. And if you don't have this probe pen and you don't know how to find point, at least after doing massage, as you saw on the picture, at least this is general treatment. First, I will show general treatment so that at least you do something. If you have problem after doing good massage, fenugreek seeds, yes, cover this joint completely. Night. And this paper tape should not, and cover all this area with seeds, front, back, left, right. And this paper tape should not be very tight, and also it should not be very loose. Okay. And now I want to say that foot is very important for treating knee. Some people, they miss, some patient doctors, Sujok doctors, they don't need treat this. So middle toe, left knee problem, left foot, middle toe, middle point. So this area, like bichua pehante hai na, bichua, same. In this area, after doing massage, tie this, but here we need this small size tape. This is broad. Okay, so in foot, massage this, and you, with the help of paper tape, tie fenugreek seed. If right knee problem, in right hand, middle finger, middle joint, and same you will do on right foot, middle toe, middle joint. So this you have done it randomly without finding points. But now if you have patience, and I recommend, find the painful point for sure. So I want to show this. And don't forget to do that UV meridian ending point. Don't forget, I do for all my patients in leg diseases. And lumbar also. Lumbar point, all leg diseases. So now in basic system, now see, this is kneecap point. If you want to focus exact point. So this 1 point, 1 star magnet is enough. So for left knee, now see, for left knee, this point you have to massage nicely. You can massage surrounding area also nicely. And right knee, see here. So means your knee point is touching the index finger. This is the landmark. In right hand, this is the knee point. Index finger is touching. Okay. So after doing good massage, you can apply seed, star magnet. Yes, as you saw. So this is your basic system. In insect system, now in left hand, please pay attention. In left hand, left knee, all left knee points are towards the little finger. Okay, we have multiple knee points. So the clue is, if person has left knee problem, then in left hand, points towards the little finger. So this is the joint. These are the joints. And this is yin yang line. Yes, in all fingers. So same story in all fingers. I will explain on one finger. So same thing is on all fingers. So this is a middle joint and here is the yin yang line. So knee point is here. Okay. Now one by one you will check. Yes. Check. Check. Now pain is there, but not very strange and sharp pain, because pain, everyone will get pain. Even you don't have knee pain, you will get pain here because this is little bit bony area. Pain is there. But idea is jumping pain, ouch pain, strange pain, sharp pain. Yes, which can shake your body. That is called real pain. Even with the mild pressure, you get pain. This is considered as the disease point. If you press deeply, everyone will get pain. That is not pain point. Okay. So you check one by one. Same area, check one by one. Wherever you get pain, you will apply seed here. So what you can do, one, you combine with basic system and insect system. So if left knee problem, if you find knee pain, point is good. Otherwise, you can just apply seed. You can cover this joint with seed, and one point you can apply in insect system. Check all, wherever you find the pain, you apply. If right knee pain, you will treat this joint, and in according to basic system, this is the point. But according to insect system, finger therapy, your right knee point is here. So see, now the clue is in left hand, left knee point is towards the little finger. This is left knee, left knee, left knee, left knee. So this side, okay, left knee, left knee, left knee, left knee. In right hand, according to finger therapy, where is right knee point? Towards the little finger. See, right knee, right knee, right knee, right knee. Okay, so one you do on main system, and second point on insect system finger therapy, you work out of 4 points, which point is painful. You will apply one seed, and don't forget to treat lumbar and UV meridian ending point. So this is of course we have in severe cases we add 6-key and triurgin, but I believe that this much can help you, and I hope that you will use this, and definitely you will see the results. Okay, so we finished our today's topic, and
actually, so many people have so many doubts, and many of them are wanted to share their experience also. So I think, can we arrange one session to share their experience as well as they can clear their doubts?
yes, maybe next time we can have this kind of, you can ask questions.
That should be in connection with the last session too. That is from mouth to organ, all the diseases, and now it is all the diseases related with the spine. Like that, we
Yes.
can arrange.
Of course, yes, yes.
Nice of you, ma'am. Thank you very much, all dear friends. In future also, we expect your cooperation by attending in person to all the live sessions. Ma'am is also very interested to give more knowledges to you, along with the more protocols with the live practicals and all. Thank you so much, ma'am. Smile, thank you.
Smile.
All friends, we'll meet.
Thank you so much, ma'am. Thank you so much, ma'am.
Thank you, ma'am.
Thank you so much, ma'am.
Thank you, ma'am.
Thank you so much, ma'am.
Thank you, ma'am.
Thank you, ma'am. Thank you very much.
Project solver पे लीजिएगा.
Very nice, ma'am.
Thank you, ma'am.
Thanks a
Project
lot,
solver
ma'am.
पे लीजिएगा.
Thank you, ma'am.
Thank you, ma'am. Project solver पे लीजिएगा, madam.
Thank you. Thank you.
Thank you so much, ma'am. God bless you.
Thank you, ma'am.
Bye.
Thank you, ma'am.
See you. Bye bye. See you next month.